This is a somewhat unusual webinar for the FCA, so let me tell you first who's going to be on it. I won't read you the bios because you got them in print. The important things to know are Steve Hoffman is a lawyer and interested in global health, which is an interesting combination, and has been quite active in a number of areas for a while. And I've known him for several years. Mathieu Poirier, who's now a professor of epidemiology at York University in Toronto, and more standard kind of public health person, and Linda Bald in Edinburgh, who I think many of you know, who is a professor of public health there and has been doing a fair bit of international stuff. So the reason for this webinar is that there are a couple of studies that have just come out in the British Medical Journal about the FCTC that may be somewhat surprising to people. And in particular, one could imagine somebody spinning it to tell us that we have been wasting our time for the last couple of decades. And rather than everybody go off in different directions and try to react to that sort of without knowing all the details, we thought it would be really helpful to actually talk to the researchers involved, and to have Linda, who wrote an editorial on the topic and who's obviously had more time to think about it, to provide a little bit of context. I think I'll leave it at that in the interest of time. And Ryan, I think, has the word to say about the logistics of using this software. Over to you, Ryan.
Sure, thanks, Francis. Hi, everyone. Ryan Forrest from FCA here. Just a couple of notes on how to use Zoom to make sure that things run smoothly for everyone this morning. We have muted all of the participants' microphones, save for the speakers' microphones. If you could please just make sure to keep your microphone closed for the duration of the webinar, that would be really helpful so that we can hear our speakers loudly and clearly. After we hear from the presenters, there's going to be a short Q&A session. So throughout the webinar, please feel free to submit your questions in writing for the Q&A period at the end of the webinar. And the way to do that is to click on the chat box logo in the menu bar at the bottom of the screen. There will be a small box that pops up, and you can type your questions in there, and then we'll address them as we get towards the end of the webinar. And I think that's everything. So Stephen and Mathieu, over to you.
Great. First, a big thank you, Francis and the FCA, for hosting this webinar. It was only 12 hours ago that the papers were published, so I think it's just really impressive that the FCA was able to organize this, and that so many of you are here attending. Very much appreciated. I also just very much wanted to thank the people who are involved in this study. So this is a team science effort. There's 21 authors involved in the two papers that we're going to be describing today. And so Mathieu and I are really quite honored to be able to present it on behalf of the whole team, many of whom I also know are joining today. So with that, I'll launch right in. And I'll first convey that in this today we're describing these two papers published 12 hours ago. The first one is looking at cigarette consumption estimates for 71 countries over a 45 time year period. The second one then used that data to evaluate whether the Framework Convention on Tobacco Control has had an effect on global cigarette consumption, and then looking at different regional variations. We're going to go into that in detail over the next 20 minutes. But I wanted to just emphasize these papers are online now. They're open access, which means there's no paywall. And also, along with the papers, there's also quite a bit of supplementary materials. When doing this study, we wanted to make sure that it was done in a way that was super transparent and replicable. So we've actually published extensive methodological appendices. We've also, the data that we used is all open access and available for those who want to use it for non-commercial purposes. And we've also, in fact, published our statistical codes as well using this data software. So if anyone wants to replicate, play around with the data, use it, please do. That's really why we did this effort. So what we're going to do today, we're going to very briefly describe the data that we collected. We're going to talk about our quasi-experimental analysis of the data, which was about looking at the effects of the Framework Convention on Tobacco Control. We'll draw out some study implications, and then there'll be hopefully quite a bit of time for questions and discussion. So why the FCTC? So this is, I think, actually a more interesting question than might initially meet the eye, and it's because, by way of background, I'm an international lawyer, so I'm someone who marries methods of epidemiology with international law, and so my own research agenda at York University in Canada is really about trying to tease out what effects do international laws have on various outcomes. And so specifically, the Global Strategy Lab, which I direct, is one of the big focus is trying to actually increase the rigor in which we're better understanding the science of global strategy. We're really interested in understanding, okay, if there's a global goal, what's the best global governance instrument to use for different kinds of challenges? So the FCTC provides a really, really important example in the sense that it's one of the few treaties out there that's on global health, which is our focus, but it's also one of the very few treaties that has a very clear outcome variable of interest. And so in this case, it's very clear that the FCTC was intended to reduce tobacco consumption. Whereas other treaties, like human rights treaties, I mean, we know that they're trying to promote human rights, but it's much harder to actually measure human rights. And so what this provides us with is that quite a unique opportunity. And then because also of that clear outcome variable, in the end, we were able to do a quasi-experimental study of this treaty in a way that no one ever has done on a treaty before. So, and because our lab is also doing a systematic review of these kinds of studies at the same time across all different types of international treaties, we're pretty sure that this now represents the most rigorous impact evaluation of an international law. So that's quite exciting for us from a scientific perspective, but also we very much hope that this is helpful for global tobacco control champions who've been working so hard and trying, hopefully this study can also better help understand how do we draw the most value out of this instrument now that it already exists. So what we did is we undertook a systematic data collection efforts. We tried to gather as much tobacco consumption data around the world as possible. We looked in over 200 countries. We looked to statistical agencies. We contacted experts. We searched publications. We looked at, of course, at UN sources. And basically what we tried to do is bring together as many consumption estimates that were out there, and then we quality appraised them. So we looked at trying to find out which ones would be most, for which we would have the greatest confidence. And so what you'll see on this slide is this is a map of the data we were able to find for 71 countries, most of which we have high confidence in that data. Some, though, we have moderate confidence, and other data there's low confidence, but not too many countries for low confidence. And so then what we did is, when bringing this data together, it represents over 95% of global cigarette consumption and 85% of the world's population. And then we made this data publicly available. So you'll see in the link at the bottom of the slide, for anyone who does want to access the data, you can go right in and do so. Why is this data needed? Well, I think for those in the tobacco control fields, we know that there is actually existing data. So the Institute for Health Metrics and Evaluation at the University of Washington published a study a few years ago that looked at global consumption estimates. And so that is great, and I think that everyone here would agree that's been probably a very helpful resource. The challenge is that the way that that data is generated, it means that it gets smoothed out. So what you'll see in this figure is the lines that some of this data is for the Institute of Health Metrics and Evaluation. That's the smooth data. It's just because their data generating process, when they're filling in missing data, they're actually purposefully smoothing out any discontinuities that we would naturally see from year to year. Our data was attempting to make sure we didn't smooth out those discontinuities. And that's really important because if one wants to do a quasi-experimental impact evaluation, the whole method depends on those discontinuities. It's actually the discontinuities that's what allows us to do the rigorous science. And by smoothing out, the IHME data doesn't allow for that kind of rigorous evaluation, although it's great for other purposes. And I think we're all very appreciative that IHME did that work. In terms of then using this data for our quasi-experimental analysis, basically what we tried to do is figure out, okay, this Framework Convention on Tobacco Control, it was an intervention. We conceptualized it as a global intervention. So that means that it's not just something that has an effect on those countries that decide to legally ratify it, but actually it's a normative instrument that was on the world, and it would have impacts overall in the global space. And so that, though, it's not just because that the Framework Convention on Tobacco Control is adopted that suddenly lots of things happen. Of course, there's many different steps. After negotiation and adoption, there's still, of course, ratification. There's still, of course, individual countries deciding whether they're going to act on their own ratification. If the country passes a law, that doesn't mean the law is acted upon and implemented into programs and subsequent policies. Lots of different steps happen. What we show here on this logic model is that at least at a global level, you can imagine this is the way that the Framework Convention on Tobacco Control could ultimately have effects on that single final outcome variable of interest, which is tobacco consumption. And of course, there's different pathways. But what's important here for our study would be to figure out, was the adoption of the Framework Convention on Tobacco Control in 2003, was that associated with accelerated declines in tobacco consumption? And so I think then what's really important is to think about the different kinds of effects that an instrument, that a global governance instrument like the FCTC could possibly have. And the first, which people I think often think of, is listed last here, which is the legal effects. And so someone might assume that the Framework Convention, it would mostly have effect because countries legally accept to do it and they've ratified it. That's one option. A second option is that there's socializing effects. So it's the power of the process. Just by having countries come together with civil society, negotiating an instrument, it shares learning, best practices, and motivates action. That would be a socialization effect. The third option, which is listed in the middle here, is a normative effect. This is the one that we hypothesized was probably the dominant effect of the FCTC. And so then we would expect, starting in 2003, to start to see effects of this treaty on tobacco consumption over time. Now, in our study, we focused on that. So all the figures we show will be focusing on those normative effects. We did also conduct robustness checks on the other two and found similar results. So our conclusions, or what we described today, would apply actually to all three different kinds of effects, but we'll mostly focus on the normative effects. And so the last slide I'll present before turning it over to Mathieu is really just to emphasize that we are definitely not disputing that tobacco control laws work. They work. There is so much evidence to support the effectiveness of tobacco control laws. And in our papers, we bring together this table really just to emphasize the overwhelming amount of science in this space. And certainly this study does not at all challenge that science. In fact, it builds on it and was motivated by it. But the key is when implemented, right? And so what our study does is it takes a bit of a look at the FCTC, and we don't assume that just because a country ratifies it, that the country actually acts on it. And so then our question that we tried to answer is, okay, was the FCTC treaty mechanism, was that associated with an accelerated decline in tobacco consumption? And if not, then at least from our perspective, it doesn't question the continued value of the FCTC as it is now. It might question whether in the 1990s it was the right strategy to pursue at that time. But what we're definitely not questioning is that tobacco is one of the most defining challenges of this century. We need more action, and we need to fully implement tobacco control laws to make a difference here. Mathieu.
Great. So now we're going to dive a bit into the data, the methods we used in the paper, and some of the detailed results. And one of the first things I'll emphasize is that obviously when we look at trends around the world, they're highly divergent. If you look at just high-income countries, just looking at the raw data, you can see a pretty continual decline, and low-income countries have remained at a pretty low level, and middle-income countries have basically risen pretty steadily over time. But the one I want you to focus more on is the thick purple line in the middle. That's a population-weighted global consumption average, and we're looking only at adults age 15 and older in this study. So whenever we see figures, whenever I'm talking about results, we're using per capita figures for persons age 15 and older in each country. And if we kind of zoom in on that purple line in the middle, this is just it blown up and the scale changed a bit. But we see that there has essentially been a globally declining trend in cigarette consumption since around 1985. So if we were to just evaluate, has the FCTC had an effect starting either in 1999 or 2003 or 2005 when it was actually ratified, we would find a significant effect if we're just looking at the year-over-year change, but that's not really the policy relevant question for us. It's more, has the pre-existing decline been accelerated by the FCTC mechanism? And this is just a little timeline of all the things that have happened, which again go back to our socialization effects, the normative effects, and the ratification effects. And each one of them have happened during that global decline. So we had to use what are called quasi-experimental methods. And when we say quasi-experimental methods, we're looking at a global outcome. So in an ideal world, we would actually use an RCT and maybe randomize one planet and look at another comparison planet, apply the FCTC on one and not apply the FCTC on another. We obviously can't do that, so we have to basically infer what a counterfactual situation would look like. And in this study, we use two separate methods, which more or less come to the same conclusion. I'll go into detail for each, and I'll start with the interrupted time series analysis. This analysis used a null hypothesis that the FCTC has not accelerated a pre-existing decline in global cigarette consumption. And we're looking for a change in either the level or the slope of tobacco consumption after 2003, which is again our primary analysis. So has there been a one-time change, either up or down, and has the slope of that change declined or increased over time? The one challenge we had is that the data are non-stationary, which means that there's this pre-existing trend. So we had to use first differencing, which just means that we're looking at the year-over-year change rather than the trend itself. And so we're looking at accelerations rather than just the trend. So going into the results, if we're looking at just the global level, the interrupted time series analysis found no significant change before and after the FCTC in either level or slope. So that's, again, just on a global level. However, if we look at a couple stratified analyses, we did start to see some suggestive results. There was a significant decrease in Europe, and there was also a significant increase in upper middle income countries, in low and middle income countries, Oceania, Americas, Asia, and China especially. And so these suggestive trends started to give us an idea of what we might be looking for. And we moved on to the next quasi-experimental analysis. But actually before that, we did do several robustness checks. Again, we used 1999 as an intervention year instead of 2003 to see if the socialization effects are more important than the normative effects. We also looked at legal effects, and in order to do that, we aligned every single year that each country ratified the FCTC into law as a year zero, and then looked year -1, -2, -3 from there and forward. And we also looked at composition effects. We removed China and also countries that have divided since 1970. So countries like former Soviet Union, like former Yugoslavia, we took that out just in case it might bias the sample. Removing either one of those sets of countries did not affect our results. So we're pretty confident that this is the actual effect that we're seeing. Moving on to the in-sample forecast event model. So this is a separate method. It's not relying on a time trend only. Instead, it's relying on country and year specific covariates. And we look at the relationship between these explanatory factors in every country and year before 2003, and then project that out from 2003 to 2013. And we see what would we expect global consumption to look like if we're relying on the relationship between these explanatory factors and cigarette consumption. And the variables we used are economic factors, political factors, human development, and other. So things like GDP growth. We used VDEM, political variables, and we looked at gender parity, education, things we know are associated with cigarette consumption. And if we look at the global results, yet again, we have the same result. We can't find a significant change in global consumption after the FCTC. It's well within the bounds of, well within our prediction intervals. And if anything, the pink dotted line, which is the actual consumption compared to the purple predicted line, it appears to be slightly higher, again, well within those prediction intervals, so we can't say that there's any significant difference. So again, we're only looking at global results here, but once we start to stratify, things get a bit more interesting. What you see here on the left are results for high income countries only. On the right are low and middle income countries only. So obviously, high income countries were starting from a higher consumption level, and we see after the adoption of the FCTC a significant change in consumption. It is much lower than we would otherwise expect, predicting on these national political economic factors. And conversely, on the right, low and middle income countries, we see the opposite trend. We see significantly higher consumption than we would have predicted. And if we project about 10 years out from the intervention point for high-income countries, it's about 1,000 cigarettes fewer per person per year than we would have predicted. And on the right and low and middle-income countries, it's about 500 cigarettes more per person per year than we would have predicted. These trends are also echoed by regional stratification. The Americas, we see not too much happening differently than we would have expected. There was a pre-existing decline, which has remained pretty steady over time. This does change a bit if we look at only Canada and US versus the rest of Latin America and the Caribbean, but mostly has followed a pre-existing trend. Europe is where we see a lot of the changes in what we would have predicted. Again, about 1,000 cigarettes fewer per person per year, 10 years after the intervention than we would have expected. Asia is where we see a lot of the changes happening in low and middle income countries. But again, with the robustness checks, I want to emphasize, these are not dependent on only China or a few other high population countries. We took them out to see if it changed our results. They don't. We also took out population weighting to see if that made a change. It didn't. We used also a more complicated 1- and 2-year distributed lag model to see if there's some lagged effects from these different explanatory variables. It didn't make a change, and it was also not as predictive of a model as our primary model, so we didn't use those. But again, those are in the appendices, so if you want to check those out, please do. And we did also use some alternative models with regional, sub-regional dummy variables, and also more simple predictive models. Again, all of these point to a similar conclusion that global consumption did not significantly change after the adoption of the FCTC. Yeah. So some of the strengths of this study are that it's, we believe, the most complete. We use the most complete verified non-model tobacco consumption data set yet, which again is open access. Please do read how we gather that data and access it in the online data bank. We triangularized to the use of 2 complementary quasi-experimental methods, so it's not relying on one or the other, but both are pointing in the same conclusion. We used dozens of robustness checks in a comprehensive effort to find these effects. I think we counted at one point about 48 robustness checks. Some limitations, data is missing for many countries, but if we look at the how much of an impact these might have, it amounts for about for less than 5% of global consumption. So we're pretty confident that we're gathering the vast majority of global consumption in these analyses, and so we're pretty confident that these global conclusions are accurate. We did only investigate cigarette consumption. These do not include things like e-cigarettes or water tobacco or different products. It's true that more time may be needed to see effects, and we will be happy to replicate this study further down the road. And specifically to the methods themselves, the ITS, the interrupted time series analysis, assumes a constant underlying time trend in the absence of intervention. And the event model has a separate set of assumptions that there is a constant association between cigarette consumption and the model's explanatory variables before and after the intervention.
So in terms of the implications of what we found, basically we found a couple of things. One is we found a gap between efficacy and effectiveness. By that, what I mean is, theoretically, we know that the FCTC should have big impacts because it's promoting policies that hundreds, if not thousands of studies have shown to be extremely effective when implemented. And so that's one big finding here. And when thinking of why there might be this gap between efficacy and effectiveness, I think it's really important to be thinking about the implementation capacity of countries to actually act on this treaty. I think we should be critical of the treaty itself. I mean, this is a treaty that doesn't have enforcement mechanisms to motivate implementation. That's one reason why organizations like the Framework Convention Alliance are so important, because they're, in a sense, and working with other organizations, helping to motivate compliance. But the treaty itself doesn't have those sort of mechanisms. And third, with globalization and illicit trade in tobacco contraband, we might have been seeing these last few years it easier to evade tobacco controls by companies. The other big finding is that we have seen big differences between high-income and low-income countries. In terms of high-income countries, we think one of the big reasons for this difference is European Union accession rules, which have required many countries, particularly in Eastern Europe, to implement quite stringent tobacco control measures as part of entering the European Union. And then in low and middle income countries where we saw overall, I guess that's where the news is most pressing, many countries' incomes are rising faster than tobacco prices, which actually has been then making tobacco more affordable over time, which is of course not what we want to see. Now, bringing these two sort of contradictions together, our best guess as to why we think this is happening is that when you have a treaty like the Framework Convention on Tobacco Control, and when there's varied implementation of it and tobacco control policies, what we see is market equilibrium effects, which are basically incentivizing tobacco industry to move its activities from high-income countries, where they faced increasingly stringent regulations, towards low and middle-income countries and Asian countries. And while we saw greater per capita declines in high-income countries, because there's more consumption, because there's more people in low and middle-income countries than in high-income countries, overall, the global effect of the treaty, we couldn't find one of overall global effect. So with that, I'm just going to conclude to say that our conclusion is hopefully similar to what the messaging that the tobacco control community has been saying for quite some time, which is that first we need to rapidly scale up the implementation of proven tobacco control policies. I think this study further motivates that it needs to be a particular focus on low and middle income countries and in Asian countries. And ultimately, we need to continue and even more assertively counteract the transnational activities of the tobacco industry. So with that, we'll conclude our presentation. Thank you in advance, Professor Linda Bald, for your commentary, and we look forward to the discussion.
Great, so thank you very much, Stephen and Mathieu. I've just requested you to let me have controls, Mathieu, if you can see that. Great, thank you. So I'm really delighted to join you as well, and thank you also from me to the authors and to the Framework Convention Alliance for hosting this webinar. So I wrote a very short editorial to accompany these two incredibly useful articles in the British Medical Journal, and also a third article just to highlight that's been published in the same issue from Professor David Hammond and colleagues in Waterloo. So we have a fantastic trio of Canadian articles in the BMJ this week, which is brilliant. So I'm just going to make, I'm not sure I can do this actually. Oh, there we are. I'm going to make a few points. I'm just going to emphasize the importance of this new resource in terms of the data, say something about other sources of data and the complementarity between this important work and then try and provide some remarks from a researcher who's been working in tobacco control for many years in terms of the context and how we can interpret some of these findings, which I think is so important, and also use them to inform what we do next. And then just to reflect on some of the remaining challenges. So, yeah, if you just control mine, because it's not working for me, thank you. So in terms of the database, this is a hugely valuable new resource for researchers. I would encourage everybody who's on the line and to tell their colleagues about this. In this day and age, we do need to make our data available and transparent, which is exactly what the Global Strategy Lab have made a strong commitment to doing, and this is an exemplar. And they say on their website how you can request access. In terms of the research itself, as Stephen said at the beginning, this is a hugely impressive example of team science. Multiple languages spoken amongst the researchers in the team, and trying to look back over 45 years, dealing, I'm sure, with incredibly challenging different types of data that required careful appraisal and a lot of cleaning, I would imagine. So just to encourage colleagues to think about this as a resource for future evaluations. So not just thinking about global, I was particularly interested in the country and income stratification that the colleagues had done for this study, but also looking at national and regional effects in terms of retrospectively on cigarette consumption. And I think individual researchers could go back and do that and look at how things have changed over time. The other invaluable thing that it does is identifies important differences, as we've already heard from Stephen in terms of previous work. So next slide. So I just wanted to reflect on how these data could be used in terms of policy and surveillance. So I think the authors make the point in their article that this doesn't replace these prevalence surveys. In many countries, they're slow. The global efforts we have, like the Global Youth Tobacco Survey, etc., they're not done every year. They're certainly not comprehensive in terms of the countries that they cover. So they're hugely valuable, but they have strong limitations. And then, as you will know, national prevalence surveys in some countries, they are actually quite rapid, but in others, they're very scarce. And particularly in the WHO Afro region, we have some major challenges with data on tobacco consumption. And then finally, to highlight another important resource led by Canadians, the International Tobacco Control Policy Evaluation Project, which is uniquely useful and active in, I think, about 26, 28 countries now. Next slide. So I think Stephen and Mathieu have already highlighted, this is a study about cigarette consumption. Now clearly, cigarettes are the dominant global form of tobacco consumption, and it makes complete sense that that was what was used as an exemplar. But I just wanted to highlight that looking ahead, we need to be looking in particular at oral tobacco products, just because of the sheer number of people that are using these, not just in South Asia, but in other parts of the world as well. These are harmful products except for low nitrosamine options, but in terms of the data we have available, it is generally poor. So I think in terms of future surveillance, this is a priority topic for us to be looking at, and of course there is important research underway on smokeless tobacco to try and improve some of the data that's available. Next slide. So just to turn now to the evaluation for the last few minutes, I think as we've already heard from Stephen and Mathieu, there's an important context here. So this is a slide you'll all be familiar with of the global tobacco epidemic. And we have seen in many ways, although this has limitations, a validation of this approach. So there's a natural sequence of where tobacco use starts and where it's been falling. And of course, it has been falling for many years in high-income countries. And through population growth and other factors that I'll come on to, unfortunately, we have seen this shifting epidemic from high-income countries to lower-income countries. And in terms of future challenges, the WHO Afro region in particular is projected to have significant growth in the coming decades, potentially in tobacco use. So that's a big challenge for us, and those underlying trends are important to understand. Next slide. But what I would emphasize, as the authors have already said, is that when tobacco control measures are implemented, we do see an acceleration. I think that's what this study shows for high-income countries and for Europe. So this is just an example from the UK. Now, tobacco rates began to fall from about the 1960s, but the acceleration that we've observed in my own country since the introduction of the FCTC has been important. And in fact, just this week we've seen, or just this month, some new evidence from the impact work that the Framework Convention on Tobacco Control and the Secretariat did, some journal articles that have been published in tobacco control, looking at the impact assessment expert group findings. And the quote from policymakers in the UK is that the FCTC assisted us to accelerate the implementation of effective tobacco control measures. Next slide. So, can we move the next one on? Thank you, that's great. So I think the key finding, as we heard from Mathieu and Stephen, the one previously, is that one of the main findings from the study is that there is this implementation gap, and that has been found in other studies. So looking at the global progress in FCTC implementation is highly variable. And some of the articles that have been particularly poorly implemented are things like Article 5.3 to protect against tobacco industry interference, alternative livelihoods, and some of the key governance and international collaboration elements. Next slide. So other studies have examined the implementation of the FCTC, and I would draw your attention to the table that Stephen and Mathieu have in their hugely useful article that really, I think, is a one-stop shop to look at what's being published for those researchers that are interested. But just to focus on Shannon Gravely's work in this example here, we know that the highest level of implementation of articles does reduce prevalence, and the more articles are fully implemented, the greater the rate of decline. So this means implementation is a priority. But the big challenges, I think many of you are aware, are that the resources available for implementation of the FCTC, both globally actually, but also in particular regions of the world, are tiny. And that's why important work that's underway now, like the FCTC 2030 project led by the FCTC Secretariat in 15 countries in particular, is hugely important. That's to strengthen governance and improve the capacity of those countries to respond. And also we've seen important developments like the global strategy to accelerate tobacco control, which is really only just being approved at the last COP. So in many ways, this treaty is still young. We need more resources, we need more capacity, and we need a concentrated effort. Next slide, and just my last couple of slides, two final slides, and then to hand over to the discussion. The other big, well, probably the biggest challenge, as I'm sure everybody on the line knows, is the lack of implementation of Article 5.3 and the industry's ability to influence tobacco control policy, to stall, decline, and delay effective measures as recommended by the Global Treaty. And this is just an example from Professor Jeff Collin looking at the extent to which different types of countries have implemented measures to protect public health policies from the tobacco industry and its associates in terms of policy implementation. And you can see very variable adoption there. So that is a huge challenge and one that we must all continue to unite to address. And then my concluding comments. So just to emphasize again that Professor Hoffman, his team, and others at the Global Strategy Lab and colleagues need to be commended for this new research, not just on tobacco control, but as an example for other colleagues in different topics to look at treaties and to do robust evaluations and studies of data collection and resources that can provide new evidence. So I think what they show clearly is the full potential of the FCTC has not yet been reached, but I think that many people are working towards trying to achieve that. So there's an urgent need for continued investment in international tobacco control. We need to increase capacity, improve governance, and enhance cooperation across countries, particularly to combat tobacco industry influence, but also to reduce the use of all forms of tobacco products around the globe. So thank you very much for listening.
Thank you so much, Linda, for that presentation, and thank you as well to Mathieu and Stephen for their very interesting presentation as well. We're going to move on now to the Q&A session, or the Q&A portion of the webinar. I've seen a number of questions come through in the chat box so far. Just as a reminder to anybody who perhaps joined a little bit late, if you would like to add a question, you can do so by typing that in the chat box on the right-hand side of the screen. So maybe we can get started with some of the questions that have come through already. I saw one from Francis. Is there an implicit assumption that the harm from tobacco consumption is directly or linearly related to consumption per capita? And if so, is that actually justified? So for example, where incomes go up, some previously poorer smokers may take fewer puffs per cigarette, but smoke more cigarettes and remain at the same level of harm. So was there any effort made to compare with prevalence data to test for this sort of effect?
Right, so we do recognize that cessation is more important than reducing intensity. And a lot of what we're dealing with in this project is a lack of internationally comparable, rigorously collected data that we could compare from country to country. And in an ideal world, we would look at both prevalence and intensity, and we have a few ideas of how we might do that in the future. But for now, consumption was the most straightforward and well understood way of comparing these outcomes from country to country on a global level. So while it is true that it does treat consumption, that is cigarettes per adult per year, as the outcome of interest, which we think is valid, and it gives us more confidence in our quasi-experimental methods and results. In an ideal world, we would be also looking at prevalence, but just comparing all of the different surveys in every country and the gaps in years that would be covered, it just wasn't feasible for this study.
Thank you. Another question has come through just about, I think perhaps about which countries were considered as part of the analysis. Since India constitutes a significant amount of consumption, was it taken into account while calculating the effects of the FCTC on cigarette consumption?
Yeah, so we, well, first, just to clarify, we searched for data from basically every country. So it's 215 countries, I think, that we searched for data, for which we only found data for 71. India is included. And in fact, in our analysis, in the paper, we actually did this analysis just for India as well. And we report that in the article. The idea was that of course, it makes sense to do a global analysis, but also to look at, did the FCTC have an effect on individual countries? So we do that for the top 10 consuming countries, and that includes India.
Great.
So that was a great question to let me say and encourage everyone to check out the studies when they have time, because some of those more detailed things we definitely thought of and agree are really important. Thanks for that question.
I've got another question here about the methodology. So regarding the interrupted time series model, why did you decide to use a time series dataset over a panel dataset? Would there be an impact of the imbalance in the number of years pre and post treatment? And were there other variables that you did control for?
So we did have balance. It was strongly balanced panel, but so for the second method, we focused more on the panel aspects, looking at those country-specific covariates. The first one is just, I think it's a commonly used and understood method in evaluating laws, whether it's national or global. And it's one that I think demonstrates pretty clearly, is there a break in time trend? Is it a one-time break? Is there a slope change? It's one that most public health researchers are familiar with, at least. So we did want to conduct the interrupted time series analysis. And we think since it concords with the conclusion of the other method, which has a bit more information in it, that we're pretty confident in both. And also the stratified analyses point in the same way, that low and middle income countries did significantly increase, that Europe did significantly decrease. So they're two complementary methods, but I think they're both valuable in their own way.
The question gives us a good opportunity to emphasize, at least from our perspective, the event model is the one that's the more interesting one. I mean, the difficulty with the event model, or the challenge, is that it's not a very common method in health research, medical research, public health. And really that was a method that we adopted from financial economics. It's a method that was originally designed to help courts understand the cost of stock splits. And the reason courts is because there are sometimes people who sued each other after stock splits happened. We applied that and had to figure out how to test for significance. So it's actually quite a methodological innovation that we think, I mean, it has a different set of assumptions, but we think that it's quite a strong method. But what was important then is that we also used a method that was more familiar to those who we were hoping would read the study. And ideally, the hope was that maybe the two would actually achieve the same results. And in this case, that did happen, which hopefully should further boost confidence in this study.
I see that there's also been a couple of questions that have come through, I think, that are asking sort of the same thing, about were changes in trends in countries that ratified the FCTC compared with trends in countries that did not, as sort of another dimension to the quasi-experimental design?
So I think that's where the real innovation actually is with this study, in the sense that we conceptualize the FCTC as a global population health intervention. What that allows us to then do is not worry about the market equilibrium effects that would be there in the world, but actually embrace it, that accepting the fact that treaties not only influence those countries that have legally ratified it, but actually also influence other countries as well. And taking that on as just one of the effects that we should be expecting from treaties, and then trying to measure those effects overall. So from our perspective, actually, that's part of the innovation of this study, is thinking of it not about comparing countries that ratified or to those that didn't, but actually thinking of it in global terms. That being said, I think we did something to get at the question about ratification or the legal effect of this treaty. I think we did something even better, because instead of sort of comparing those that ratified to those that didn't, which, well, there aren't that many countries that haven't ratified, and there are sort of special cases. So instead of doing that, I think we did better, because what we did is we looked at the effect as time. So we basically aligned the data for different countries according to the year in which they ratified the treaty, using time as our way to try to tease out an effect, a legal effect from this treaty. And as Mathieu mentioned, we did that as part of our robustness checks, and we didn't find different results from the main analysis.
Perfect. And another theme that I'm seeing come through in some of the questions that people are submitting around the sources of data for the ICC database. I've got a comment from Andrew Black, who works with the FCTC 2030 project, who mentions that they work extensively in LMICs and they're finding it very difficult to get robust data on tobacco. So I think folks might be interested to know a little bit more about where the data is coming from, whether any of this data is coming from the tobacco industry, and whether the authors believe that consumption is how many cigarettes were smoked in the year.
Right. So this was a pretty extensive effort gathering this data. We were building off of previous efforts by organizations and people like the American Cancer Society and Emmanuel Guindon, who also contributed to those efforts. But we essentially looked at national statistical agencies. We looked at independent organizations that gather this kind of data, and we consulted country experts for as many countries as possible to see what was the most reliable source of data for each country, and that depended based on the country, what data source we could trust the most. And we looked at either direct sales data, or we implied sales based on production in the country, plus imports into the country, minus exports out of the country. And we also were able to compare in most countries that direct sales data to that implied sales data, and do that for every year and appraise and evaluate what we trusted the most, again, in consultation with the countries, and use that data in this study. And again, this data is all available, open access, in the International Cigarette Consumption Database, and please do log online and access it. And you can also see all the different sources that we consulted for each country. As far as consumption equaling prevalence, that is clearly not always the case in every country. It's certainly possible that prevalence might go down and consumption stays the same, or vice versa. And so they are not necessarily linked, but we would probably think that in most cases they are. And intensity of consumption is certainly a factor in contributing to ill health, and so it's certainly not inappropriate to look at. In an ideal world, again, we would be looking at both prevalence and intensity, but given the limitations of what we were able to look at, I think this is the most rigorous data that we could use.
Thank you. Just scrolling down to see the rest of the questions that have come through. A question on illicit trade. How did you account for illicit trade, which fluctuates over time? And how much of a difference do you think that that makes if your illicit trade estimates are significantly too high or too low?
Yeah, it's certainly one of the factors we talk about in the limitations section. Some countries, we were able to actually have a quantified amount of illicit trade that the country experts believed, and so we worked those into the International Cigarette Consumption Database, and they're there and they're noted where we accounted for those. In most situations, however, we were not able to account for illicit trade. So we did mark in the online database what countries are generally known to be sources of, conduits for, and destinations for illicit trade, so that you can make that judgment for yourself as to which direction at least you would expect this error to point in. And so I would say overall on a global level, we can't completely account for illicit trade. We tried to wherever possible, but it is one of our limitations.
Great. Did the research team, I should say, consider any non-linear models of causation? The logic model appears to have kind of a straight line of causation in one direction, and feedback mechanisms are important in legal change and may explain results in low and middle income countries due to, among other things, a shift in industry strategy. Also, was there any consideration of qualitative studies on implementation? There's lots of good examples of how the treaty has been used by policymakers and civil society in advancing tobacco control measures.
Yeah, so it's, I think that's a great question. I think to emphasize, the logic model was intended to be a bit simplistic in the sense that it was really trying to convey that our conception of the FCTC as a global population health intervention. So there certainly will be feedback loops and such, and I wouldn't want anyone to think that these things are not also related to each other and such. But ultimately, that wouldn't affect our analysis, because our analysis was really looking at the association between the adoption of that global population health intervention, the FCTC, with tobacco consumption around the world. So we, the figure was really more meant as a descriptive tool to help us convey that this study is different than previous studies that look at different international laws, because we're not looking at countries that ratified versus those that did not. But instead, we're looking at the effects of this treaty on the world. And as Mathieu mentioned, we think that's the policy relevant question for future global health challenges who are considering, should we be adopting an international treaty for this issue? Because when negotiating a treaty, or when kickstarting negotiations for a treaty, then you don't actually know which countries are going to ratify. You don't know how the process is going to unfold. What you're trying to do is change the world, right? Which is great. And we need lots of change in this world. But that's the decision, right? Is do you use this treaty mechanism because it will change the world in the way that we're hoping? So that's really important for us. In terms of qualitative information, we did not incorporate that into our statistical models, but we did use qualitative information in two ways. The first was in appraising the quantitative data. So as Mathieu mentioned, there was an extensive effort, and there are extensive written notes in the International Cigarette Consumption Database that gives as much information as we could about the different data sources, about why one was chosen, not the other, about what could be accounted for. There's extensive notes in there that I encourage you to check out. The other is that we use qualitative data to help us understand the results. And so, for example, there's lots of qualitative studies highlighting tobacco companies changing their focus from high-income to low-income countries. We built on that as part of understanding the results of the study.
Great, we are getting towards the end of our time. Mathieu and Stephen, can I just check, are you okay to stay on for a few minutes beyond the 1 hour? Because I see that there are still a few remaining questions from the participants. That's okay?
Happy to
Great,
do so.
Sure. So a question from Shoba. How far does the governance of the treaty itself contribute to the increasing consumption in low and middle income countries that you're reporting, both in terms of the role of LMICs where the industry is more focused in COP agenda setting and its governance led largely by the health sector, despite tobacco control being a multi-sectoral issue?
Well, that's a great question. I don't know the answer in the sense that, so our studies didn't look at that. And I wouldn't know. I mean, I do think that hopefully this study motivates a serious look at the way the world is supporting LMICs in pursuing these policies that the FCTC is promoting, because at least from what we can find, it's the health wins of tobacco control are not evenly distributed around the world, which is then an equity challenge. So I can't answer that question because I don't know, but it's, I think, a good question that we should be thinking about.
That's fair enough. Thank you for clarifying that. From James Bale, he's wondering what role this data could play in future FCTC action. The WHO study group on tobacco product regulation issued an advisory note on the global nicotine reduction strategy. So far, only the US FDA has followed the guidance. Do you hope that this data will lead to corrections, change, and future actions? I'm not totally sure if that's one that the study authors could answer. Sorry, just reading.
I'm happy to. I think when we're talking about the impact of this data, what we're really hoping is that it provides another opportunity to elevate the science of what works in what context, for whom and how in tobacco control. I think previous data, such as that provided by the Institute of Health Metrics and Evaluation, is really important and provides really great point estimates that countries can use to inform action. What it doesn't do is allow for quasi-experimental impact evaluations. So our hope is that by doing this work, by making that database open access with all the documentation, with our stated codes and everything, that we're going to enable a whole bunch of other researchers to better look at what works in different contexts. And we happen to focus on the global and the regional level for this study, but it doesn't have to be. People can use the data to look at national level as well, and maybe even find a control country to compare to based on the unique context. So that's I think a great it's a great question, because it allowed us then to end on that note with talking about the data source, encouraging people to go. So at least from us, a big thank you to the Framework Convention Alliance for hosting this, and a big thank you to everyone who joined.
Our pleasure. So I think if anybody has any additional questions, is it okay if they email you at the email addresses that are on the screen there to follow up?
Please do.
Perfect.
Thank you.
Great. So yeah, thank you again to you and to Mathieu and to Linda as well for the really interesting presentations. Hope that what we've heard today can kind of serve as a reminder to all of us in this community about the importance of the work that we're doing to support the more comprehensive implementation of the FCTC, and maybe also kind of a call to action in that there's still clearly much work to be done, particularly in LMICs and in Asia. A comment from Patricia Lambert, which I think is a good one, is that we may try to use this data to push for a robust implementation review mechanism that might try to make up for a lack of enforcement provisions. And as Linda Bald mentioned as well, to kind of double down on some of the provisions that are identified as priorities in the global strategy to accelerate tobacco control that was adopted at the last COP. And just to let everybody know, we have recorded the webinar, so we'll be sharing the link to the recording in case you have any colleagues who were not able to join who would like to catch up on what they missed. So thank you so much, everybody.
Francis, if I can also just say thank you, and like all good research, I think this raised a whole bunch of questions, which we will no doubt want to follow up on. But thank you for taking the time, and I hope at least some of the questions for people were answered. Thanks.
Thank you.